everybody, it's Tracy. It occurs to me that I talk a lot about diabetes on this channel, and most of what I talk about is type 2 diabetes or gestational diabetes. But today I want to shout out to the type 1 diabetics who make up about 10% of diabetes in pregnancy. So you may ask, what's so special about type 1 diabetes? Diabetes is diabetes, right? Wrong. Type 1 diabetes has a very different mechanism of action, and even though type 1 and type 2 diabetes and gestational diabetes have a lot in common in that they involve high blood sugar, the way that happens is very different, and the treatment can be very different. So with type 1 diabetes, your pancreas, which is a little organ that nestles next to your stomach and whose job it is to make and secrete insulin in response to meals, goes on the fritz and doesn't work or hardly works anymore, and your body doesn't make enough insulin. What that means is that the glucose that you produce when you break down a meal can't get into your cells because insulin is required for that to happen. So the only treatment for type 1 diabetes is to take insulin to help glucose move into your cells. By contrast, with type 2 diabetes and with gestational diabetes, the problem is not too little insulin. It's too much insulin, so much insulin that your body just becomes resistant to it and kind of ignores it, so that it takes more and more insulin to help glucose move inside the cells. And in type 2 diabetes, your cells are already overstuffed with insulin, and the ultimate cure for type 2 diabetes is all about how you eat. In pregnancy, we use insulin to help control blood sugars because your blood sugar is very important in determining what the baby's glucose levels are going to be. So we want that glucose out of your bloodstream and into your cells. There are several important differences that type 1 diabetics have in pregnancy as opposed to type 2 diabetics or gestational diabetics. And one of the main differences is that if you have type 1 diabetes and you become pregnant, there's a good chance that you've been diabetic for a long time, because a lot of times type 1 diabetes is diagnosed in childhood. And all your education and all your medications and everything started pretty early in life, and you've had a lot of time to forget everything you learned. Or you haven't kept up with the science because you've been doing this for so long, you kind of know how it works. You're used to taking your insulin, you're used to checking your glucoses, and after a while, you get a little bit lax. Most of the type 1 diabetics that I help in pregnancy have been diabetic for 10 years or more, and their glucoses are usually not the best because their blood glucoses have been elevated over a period of time, and your body just gets to where it doesn't notice this much anymore. But behind the scenes, if you've got elevated blood glucoses, there's a lot of damage happening, which brings me to the second difference that type 1 diabetics have, and that is that type 1 diabetics are more likely to have microscopic changes going on in the kidneys, in the brain, in the stomach, in your peripheral nerves that control your muscle movements and your sensory functions in your hands and your feet. And so what that means in pregnancy is that you're more likely to have nausea and vomiting because you have damage to the nerves that supply your stomach. And that means that your stomach doesn't empty as quickly, so everything just sort of sits there like a rock, and you get lots more nausea and have problems with that. And when you have nausea, if you take your insulin and then you eat and then you throw up, but you've still got that insulin on board, that can be really hard for diabetes in pregnancy. It means that your glucoses bounce around and they can be difficult to control in the first half of pregnancy. There's damage to the microscopic blood vessels that supply your kidneys, so you're more likely to spill protein into your urine. And the kidneys also play a big role in controlling your blood pressure, so that when you're pregnant with diabetes, you're more likely to have problems with high blood pressure and protein in your urine. The last change I want to talk about on the microscopic level with type 1 diabetes is the placental cells. So the placenta implants, and it starts out as just a little bundle of cells, and it implants into the wall of the uterus. And that happens on a microscopic level, and if you have little changes in the blood vessels in the placenta, then that can affect the growth and development of your baby. So one of the big problems that diabetics have in pregnancy is that if their glucoses are poorly controlled, the baby can just grow excessively. But with type 1 diabetes in particular, the opposite problem can happen, and babies can fail to grow or not grow to their potential, and that can be a big problem. Now let's get to how we treat diabetes, type 1 diabetes in pregnancy. And the answer is simple, it's insulin. So most of you already have a diagnosis and you come to us on insulin already. So we take a look at that and we see how good a job it's doing for you. Most of the time we use short-acting insulin for meal times, and we use a longer-acting insulin to cover you overnight. Some women come to us on an insulin pump, and those can do a great job of simulating what your pancreas would do, giving you a constant low level of basal insulin, and then we program in big boluses or larger amounts to cover you for your meals. If you're already on an insulin pump and you're doing a good job with that, fantastic. We're probably not going to change a thing, except I'm going to warn you that your insulin requirement is probably going to double or triple before the pregnancy is over. So aside from those important differences between type 1 and type 2 diabetes, we're mostly going to treat you the same as a type 2 diabetic. What's mega important in type 1 diabetes is being very consistent about how many carbohydrates you eat with each meal, because you're on an insulin pump or you're on scheduled insulin, and that is calculated to cover you for a certain number of grams of carbohydrates. So here's where it merges with type 2 diabetes. Being consistent is very important if you're on any kind of medication, or if you're just trying to control your diabetes with diet alone. What you eat, how you eat it, what time you eat it, what you eat it with, what you eat first, all of these things are so very important in controlling diabetes. So whether you have type 1 diabetes or type 2 or gestational diabetes, be consistent. And what I tell people, that I'm not sure how wise this is, but if you're going to be bad, be consistent about it. So if you know that you want to eat a muffin every morning for breakfast, then we will schedule your insulin or your medication to cover you for that. We want your insulin regimen or your medication regimen to work for you and not the other way around. So all you type 1 diabetics, still tune into the content for gestational diabetes and type 2 diabetes, because all of this does still apply to you, but you're special. And on that note, if you are planning pregnancy, it's always best to see you before you get pregnant, because then we can make a plan and you'll know a little bit more about what to expect. I can send you to the ophthalmologist. We can check an A1C. We can do any testing or any diet planning, and you can make any judging to your diabetes that we need to do, because if your glucoses are elevated in the first trimester of pregnancy, and a lot of women don't even know that they're pregnant until they're halfway through the first trimester, then that can mean big problems for your baby. And the higher your A1C, the higher the risk of birth defects. And by the time we get your glucoses under control, it might be too late to prevent some of those problems. Thanks for watching. If this is helpful to you, subscribe to the channel and leave some comments about what you'd like to hear about, and I'll do my best to help you.